Yes, Dr. Padma. I have a few concerns and considerations regarding Mr. Davis. One being that he should be educated once again on the importance of inspecting his surgical site and his left foot, just to reduce the likelihood of a recurrence of an amputation. I know he was educated before by the podiatrist, but I think it would be important just to kind of reaffirm that in his mind. When it comes to an assisted device, I would either go with a wheelchair or crutches, just depending on how able he's to function. If he's more higher functioning, I would say the crutches, but otherwise, due to his age, I'm thinking more the wheelchair. And then with that, we're going to need to make sure he gets a ramp or something to get up that one step if he does get a wheelchair while at home, just so he can access his house. Another thing I'd want him to get is an order for some kind of orthotic for his left foot, the Charcot foot, just to reduce the likelihood of an ulcer developing on that side. That side's going to have an increase in weight bearing, since he doesn't weight bearing through his right extremity anymore. Another thing we need to consider is his pain levels. We need to make sure we're always addressing it, make sure we're assessing it, trying to lower those pain levels, just to allow him to freely function and perform the exercises he needs to do in order to get discharged. He does have deficits in range of motion, so that will be easier to address, and the strength deficits and the ability to transfer with the decreased pain levels. A couple other things I would say: we need to consider his possible reduced ability to physical therapy tolerance due to things from his report, such as his poor SpO2 levels, his low hemoglobin, hematocrit, and red blood cell counts, and his previous COPD diagnosis. This is really going to limit his ability to perform the exercises we need him to do to get him discharged. When it comes to discharge planning, I would say in about 4 weeks he should be ready to go, dependent on a few things. I'm thinking maybe 5 times a week doing therapy. Some things he needs to do to be able to be discharged are being independent with his transfer ability, since he's going home by himself. He won't have anyone there to help him. Whatever AD we plan on getting him, we end up getting him, making sure he can use that properly, especially going up one step, either going up a ramp or going up one step, just so he can get into his house. And we need to make sure he is able to manage his own medications, because in the report he was abnormally orient to time, so that could lead to things like missing his medication times or taking too many and things like that. So they're just the things I am looking at when planning to discharge Mr. Davis.